everybody.
Hi.
Very good. All right, now we gotta make sure that this turns around. I'm very lucky to be able to introduce Haika Mushi. Is that close?
Correct.
Very good. All right. She was born and raised in Tanzania, went to school in Uganda, has lived in Norway, and is now here. She has a master's in business administration from, excuse me, Kampala International University, and she's been working in community health, particularly working with African immigrants and refugees in Oregon. She's a certified community health worker, and she's been with the Portland Street group since its beginning. It's as of Monday, and we'll see a little bit of that. They are now citywide. I have much more to say, but I think she'll be much more interesting. So I will post this, and it'll go out to everybody later today. But I'd much rather hear Haika. Thank you.
Ron. Good afternoon, everyone. As Ronnie introduced me, my names are Haika Mushi, and of course, I was born in Tanzania, raised in Tanzania, but I've been fortunate to live in Europe, Norway, and then now I'm here, USA, and USA now is my hometown. I just flew back from Tanzania on Monday. I'm still jet lagged, so you bear with me. I was looking forward to come to this meeting because I'd set it up before I left for Tanzania. I had a family emergency and I had to fly back to Tanzania. I had a sick parent, but unfortunately, he passed. Yeah, so, but I was so glad that I got a chance to be with my dad before he passed. And whatever closure we needed to have, I had a moment. So it was good. That was shot. So I'm so happy to be here. And maybe my dad could be around this age. So when I look at you guys, I feel like he's here. Yeah. So if I call you dad, forgive me. I feel the spirit, okay? Many of you know of us yet, but if you don't know about us, we're gonna play a video which has a recap of 1 year of us running and to show you where we are right now and the way forward, and also maybe pay attention to what we are going to ask Mayor Wheeler and the City Council people for our next budget. Can we play the video? And also I'll be open for any questions after the video.
Is in our service area. In this next phase of our evolution, we will be responding to calls via 911 every day of the week from 8 a.m. to 10 p.m. in every corner of the city. But here's a little secret. We have actually been responding to calls throughout the city for the past few weeks in training for today. So we are ready to hit the ground running. I will be able to answer more questions, specific questions about the logistics of the expansion after this part of the press conference is over. And we also have Britt Urban right here, one of our mental health crisis responders who can do one-on-one interviews with you about what she's seen since training has started here on the West Side. When we started taking calls on February 16th, 2021, we only covered 5 square miles and we responded over a regular 40-hour work week, Monday through Friday.
Response started as an idea, and now it's take flight without the support of our elected officials. Commissioner Joanne Hardesty knew that she wanted to introduce a new type of unarmed person response team before she took office. When she took her seat at the office, she learned that she did what she could about the country's first and longest running global crisis, mental Commissioner Hardesty met two groups, community groups, and representatives from Portland Fire and Rescue to come up with a working plan. And it's when she had her concept, Commissioner Hardesty
community groups, and worked with representatives from Portland Fire and Rescue to come up with a working plan. And then when she had a full concept, Commissioner Hardesty brought it to Mayor Ted Wheeler and asked for his partnership in starting the Portland Street Response Pilot. Mayor Wheeler was looking for innovative responses to difficult public safety challenges, and he threw his support behind the program by creating a special contingency fund in 2019 that planted the seeds of the current program. With his support, Portland Street Response got its first green light and funding. Let's hear from Mayor Wheeler on his thoughts on PSR's expansion.
Well, good morning and hello. It's great to be here. I want to start by thanking Commissioner Hardesty for her leadership, Chief Boone, and Portland Fire and Rescue for hosting us here today. Thanks for being here as well. I was just thinking back on our last press conference here a couple of years ago as we were announcing the closure of the city at the beginning of the COVID crisis. It feels great to be here today under completely different circumstances talking about something positive that's taking place in our community. The expansion of the Portland Street Response is an integral part of modernizing our overall public safety system into a community safety system that works for everyone. I have prioritized investments in public safety that align with the framework which guides the community safety plan to refocus, reform, and restaff as we work to improve our effectiveness, our transparency, and our accountability in our public safety system. Portland Street Responders are uniquely well trained to help those suffering with mental and behavioral health crises, and they are best positioned to address lower acuity calls. Our highly trained police officers, on the other hand, need to address severe and violent offenses to save lives and get offenders off of our streets. The Portland Street Response is perfect as a solution in that it allows each of our providers to do what they are best trained and prepared to do. Portland Street Response allows the Police Bureau to refocus on violent offenders and hold them accountable. All too often, though, there's a lack of properly trained response to de-escalate crises on our streets. Sending the right responders to the right calls with the right training is the best way to meet the needs of those who are suffering on our streets. The expansion of the Portland Street Response citywide is simply the right thing to do. We want to help people and meet them where they are immediately and with the tools that they need. Portland Street Response's data-driven approach ensures that we can now respond to calls across the entire city of Portland. This expansion means that all Portland can benefit from this innovative program. We've seen the increasing success of this program, and I'm excited for its expansion across the city. I believe there's even more room for the Portland Street Response to evolve and grow, but today, it's important that we take stock of and celebrate this important step forward with my colleague, Commissioner Joanne Hardesty, and applauding her work leading us through this effort. Commissioner Hardesty, thank you. I also want to recognize some of the innovative work done by Director Bob Causey and Commissioner Mingus Mapps as they have sought to reform our 911 emergency call system, which is a key element of the success of this program. It may not be as visible, but without the retooling of the 911 emergency call system to make sure that calls are triaged appropriately towards the Portland Street Response program, this program could not be a success, and I want to thank them and applaud them for their efforts. I'm excited to see the transformation of this passionate team of responders, and I look forward to seeing how they'll lead towards a response that serves the needs of everyone, anywhere in the city of Portland. Thank you all for being here today. Appreciate it.
but I wanted you guys to actually see the first part with Robin, who is our program manager, just to give a recap from when we started. So on your tables, you will have something like this, says mission and the milestone. So the program started, not official, like went citywide, 2014, just an idea. And it started off under the fire department. And they started because fire department has something called high utilizers. High utilizers, they're those who call 911 frequently for many things. Can be somebody who is at their home and have those pager and they need help maybe to get up. They fall maybe in the bathroom or of their wheelchair, and then they'll call for that service. So they thought of maybe use an alternative response to those high utilizers call. But also they found out that most of those calls come from people might be experiencing mental or behavior crisis. And then most of the time they are called on, somebody called for those people and not them call for themselves. So they thought of maybe we should really find an alternative response, but specifically for mental and behavior health. And 2020, some of the firefighters went through the city council and proposed a budget to start this pilot program. And then pandemic hit, everything on the pause. And then we had the George Floyd issue. And with that, they thought, oh, there was a proposed budget for mental and behavior crisis response. Why shouldn't we just fund that and pilot it and see how that will evolve? And we got money from the city council, was 4.8 million to start the pilot. So the pilot started last year, January, and February 11th, yes, last year we went live. So we started with the Lens neighborhood, and we responded to calls around Lens neighborhood specific. And then with that, come November last year, we expanded a little bit to cover the East Precinct, which is police boundary. And this year now, March, we went citywide, which was Monday. So we're really excited about this expansion. Our hours of operations are between 8 a.m. and 10 p.m. for now, every day of the week, but we're looking to go 24/7 by October this year. But then again, that will depend on the funding that we get from the city council. And for now, we are relying on the general fund from the city budget that we have. So we're not looking to ask for a lot of money. Right now, we have submitted our budget, which is 12 million per year, 24/7, having like 58 FTE. So we are hoping with that city approval, we'll be able to have 24/7 coverage by October. And there's another page I think I showed you guys somewhere in here. It will show how many vans we need, how many hours, and the route that will be taken for us to be able to go citywide and 24/7 by October. For those who don't know, we are a mobile crisis unit, and we are dispatched through the 911 and non-emergency number. So you have to call 911, and then you have to describe the call. So if the call fits our criteria, then they will dispatch us. If it does not fit our criteria, then they will dispatch either fire or police. But at least now we have an alternative response. I'll take question before I proceed, because I think we're all over the place with the video and me talking, but I welcome any questions before we proceed with the core criteria.
I understand that eventually there's going to be a rollout of a dedicated response line, 311 for PSR. Do you have any idea of the time frame for that rollout?
So 311 actually is going to take over the 503 number that we have for non-emergency. So it's not going to be specifically for PSR. It's going to replace the non-emergency number that we have. And they figure that that number is so long for a lot of people to remember. But when you have like 311, it's very easy for a lot of people to remember and call for help. But as PSR now, we have launched a marketing campaign, which has surveys, focus group discussions. We're going through a lot of process with community-based organizations and the community at large to kind of get their feedback on us having our own number, but that we don't see it happening now. There's so much at stake, I would say, because of the call criteria again. We don't want to mislead the public when they call, they use our specific number, they call for us and we don't go, because safety is key. Sometimes somebody will say, hey, I think this is a PSR call, but there's a weapon present. So the dispatcher will not send us. So if you have our own designated number and then we're not dispatched and then they send another responder, it might bring, it might turn our image to the community. We don't want to get into that now, but in the future, maybe that might be possible. And also on the nationwide level, there's a number that they are suggesting for mental health. It's a 988 number, so it's not final. If that comes to place, I think we might adopt that for the state of Oregon for all the mental health responders. But we don't know yet when we'll start with that 988 number. Yes, please.
Heike,
Yes.
are other large cities, do they have a street response team, or is Portland pioneering this?
As we speak, we have about maybe 11 different cities. There's a New York, there's San Francisco, there's Toronto, but models are different. So our model for our response here is very different for other cities. And we try to copy from the Kahoot model. I don't know how many of you are familiar with the Eugene Kahoot model, though we kind of adjusted a little bit, but close to the Kahoot model. So if you look at other cities like San Francisco, for instance, it's built under the fire department, but they don't have the mental health clinicians. They're using the peer support specialists as their clinicians. They do have medics who are from the fire department. As for us, we're trying to actually recruit medics from outside because it's cheaper that way. And then they don't have a community health workers on their team, unlike us, we do have a community health worker on the team who is able to connect people to resources and really provide the aftercare service folks might need. Yes.
So it falls under the police department then? Is that who you?
No,
who
we.
provides you your infrastructure to run your organization?
That's a very beautiful question. We are embedded in fire department.
In the fire?
So all the infrastructure, we are lucky. So we are very lucky to be under the fire department, really. And we kind of built a new division in the fire department, which is called our community health division. And it has 3 different programs, and PSR is one of the programs.
The only reason I mentioned that is because I just saw this yesterday. The
Yes.
fire department hasn't been able to figure out whenever there's a call, there was a call, and it was at a school, and they sent an ambulance and a full-size fire engine. It wasn't a fire, but that's very expensive. So hopefully
Yes.
you guys can figure that out.
Yes, and actually, at the fire department, we do have data analysts, and they are looking into that specifically. How do we save the dollars? By using the right response, what should go and what shouldn't, just to minimize our costs. And then in next year, I think we'll have like a really nice data to show how much we have served the city government by having all this alternative response. Yes, please.
This strikes me as something that's likely very good, but you've been running for a year, at least since the pilot. What data do you have, or at least anecdotes do you have of how a situation has been better served by this type of response as opposed to a police response or whatever might have happened prior to that?
Right, that's a good question, thank you. And when we started, we had our goals, our program goals, and one of the goals was for us to alleviate mental health behavior calls going to the police, and that's one of the data that we're tracking and measuring. And we do have a data dashboard in our website. I'll share our website. You could go through this live, and we update it every Monday. So it's pretty accurate. You'll see our goals, our specific goals, what we're measuring and where we're at right now. You won't see anything budget related. maybe that will come later in the future, but at least it will give you a highlight of where we've been for the pilot year till now.
I noticed in the picture on here, it looks like you're outside a homeless camp.
Yeah.
So of the calls that you've done so far, how much relate to a homeless camp or calls related to somebody out of a home or an apartment?
Yeah, it's a good question. I think I forgot to mention that currently we are not going to residents or inside businesses. All our calls are somebody has to be outside. And we see that a large number of it are people who are experiencing homelessness based on how we've collected the data. We'll ask people, where's your, maybe your address or where, and then we track if somebody say, I don't have where I live, maybe I live in a camp or wherever, we track that. And I would say majority of the numbers of people that we have encountered with, they happen to be houseless. We're not 100% sure if they live in camps like that, or they live in trailers, or maybe shelter, but they happen to be unhoused. And from the picture you see, that was last year during the heat wave. We, as the fire department, we went out there just to use preventive measures to go and provide resources to unhoused neighbors who happen to be out there during the heat wave. They didn't want to access any shelter or cooling places for many reasons. And some of them will say like, hey, our dogs or animals are not trained, and these places, when you send us, they ask us to leave our animals aside because they're not trained. So that's one of the reasons maybe they're not going there. Some of them will say, if I leave my camp now and tomorrow I come back, you won't be there, and this is the only thing I have left with me, so I cannot leave. So as really as a fire department, we thought of, you know what, we cannot abandon these people. We have to be out there, give them ice, water, whenever they need help, and not just sit down and wait for that 911 call. They don't imagine just using that preventive measure. Yes.
So when you approach a situation and maybe there's a team of 2 of you that might be through the confrontation, I know you're not armed, but what defensive measures when you come across somebody that's mentally unbalanced and could be a challenge?
I would say that's a very good question. Thank you. And really, for our dispatchers, safety is key. They won't send us where they feel like there's safety jeopardy. Meaning, if somebody calls and say, "Oh, this person is jittery and has a weapon and maybe appear to be dangerous to themselves and others," then they will not dispatch us. However, if they do send us to a person like that who may show, some sign of danger to us and even themselves, the mental health clinician, they are trained, somehow they're trained to really engage with people like that. They're using something called trauma-informed care, harm reduction. And harm reduction can look different, depends on how you define it. It can be, having water and hand it to a person. And sometimes even a cigarette, it depends, just showing up for the person and meet them where they are, and also show them that you're not there to harm them, you're there to protect them. And it starts from the way you dress, your approach, and our team really are trained for that, but very careful and cautious when it comes to safety. We haven't had any safety issues so far. And also we look into the Kahoot model that has been for 30 decades. They told us 95.5% is safe. So I don't know about the 4.5% unsafe. They never disclosed that, but they assured us for 30 decades it was safe. Any other questions?
Any other questions?
Yes.
One
So
more.
if I'm having a mental problem at home,
Mhm.
which could happen,
Often.
Yeah, if you're having a crisis and you're in your residence, you're not gonna come.
No, unfortunately, no, as of today, right? But also you do have an alternative. If you're in Multnomah County, there's a specific number for mental health crisis. Maybe I'll share with you, Jim, as well, so that I can share with people. And they're 24/7, though their response time can take a while. They have a lot of people calling. Response time is between an hour and 2 hours, but they'll get to you.
And who services those people? Is that the fire department?
No, that is funded by Multnomah County. It's nonprofit agents. They're called Project Response. And what they do, they will be dispatched along with the police.
Oh, I see.
Yes, that's what we're trying to create, another alternative whereby we don't dispatch with the police for mental health related stuff. But for now, that is the service that we have for Multnomah County, if you're experiencing that.
Well, I'm in Clackamas County, so.
Clackamas
Guess I'm on my own.
County, they do have as well. They do have, I live in Clackamas County too. They do have as well. It's a 24/7 and they will respond with the police. But also you have a mental health clinician. And if they need to take you to a place, like a service place where you need to be seen by, a provider, then they'll do that. And they could do something called involuntary order, where they will, if you don't feel like going, somehow they will make sure you go, they will push you to go without your own will. But it's a service that is there, and I know a lot of people have used that service.
Last question.
Yes.
Do citizens or callers have the ability to request police presence, or is that sole discretion of police dispatch as to whether or not the street response team shows up over an officer?
It depends on the dispatcher, but also I've seen citizens sometimes they say, hey, don't send the street response, I need the police here, and sometimes the dispatchers, they kind of look into the call and then figure, maybe, yeah, let's just send a police. And most of those calls are those when they come from, businesses, they want somebody to be moved along. And we appear to be the nicer ones. And some of them, they don't really like the nicer ones. They like the police who come with their authority and move them, that kind of thing. But dispatchers, they are trained in a way that they will try to meet your needs as a citizen, but also meet the needs of the responders you are going.
I can thank you.
Yeah,
This is
thank
really
you.